I don't know about my life. I want to stay with me. Every day you love someone, something wrong too. I don't know what to do. My heart, I won't cry for my lovely Elizabeth. Some people they ask me for you, my life. I'm crazy about that love. I believe in on the phone. Many years I like to see. Every day you run for me. I don't know what to do. My head, I want cry for my sweet Elizabeth. I say Elizabeth, but where you go? And I sing. I say sweet Elizabeth, but where you go? Come back, you love me. Many years yes, I love you. Maybe yes, you love me. Elizabeth, what happened? You know that you miss me, my love. Abdul Adams, Kuntakide. Do you see Elizabeth there? Why you want to see her? What for? Huh? Elizabeth.
All right. So we'll start this conversation today. So welcome for today's session. Isaac, how are you?
I'm very fine, my brother.
Nice to see you. Seems you look very bright. You are happy.
Of course, I have to keep myself strong and happy.
Good.
Yes.
So I want to introduce the topic of discussion. Yeah, so today we are discussing about surviving COVID-19, especially in terms of stress and anxiety. There's a lot of stress now. People are anxious. They don't know what next will come. So since you are an expert in this, I'll let you first, you will introduce yourself, and then we'll go to this discussion. But before that, I want to welcome everyone who wants to maybe join this discussion or ask any question to join. You just click the link, takes you in, very simple. So Isaac, first you can introduce yourself, who you are, what you do, and then we go to this discussion.
Thank you, Patrick. My name is Isaac Mawel, counseling psychologist, working in a hospital and also doing my own private practice through other platforms. And this is a very important topic for the day. I believe many people will follow and ask questions and benefit a lot. As you may have seen, I posted about stress, managing stress on my page just a few days ago. I think yesterday or the day before yesterday. So it's a very valid topic. Welcome, guys.
Thanks, Sam. So being a counseling psychologist, maybe first of all, you can tell us the status of maybe mental health in the country. What's the status?
Thank you. As we talk, we have an increase in the number of cases that are of mental health challenges. Because we don't have the latest statistics, but before COVID-19, we had cases of 4 cases of suicide. Four people succumbed to suicide on a daily basis. Depression was also one of the leading causes of death in terms of mental health illnesses in our country. So before COVID-19, we had already a challenge. And now as we talk, the challenge is gone because of the stress and anxiety that is related to COVID-19. We have cases of withdrawal symptoms. People are not able to access whatever they have been abusing, and that becomes an issue. People who have, because of their challenge of maybe bipolar, they are not able to go out and do their activity, things that they have been doing So we have more cases increasing. We have even cases of domestic violence than before, as it has been reported. We have more cases of sexual assault. So there is a great increase in terms of mental health challenges.
Okay, great. You're talking about, or you mentioned about bipolar, and bipolar is something like maybe in the recent past in Kenya is coming up. Maybe can you share with us the bipolar issues? What's the condition, the symptoms, and how someone can be treated?
Well, bipolar is under the list of mental disorders, and that's a mood disorder where somebody presents with uh, an episode, or let me use simple words for the sake of the layman. Things like he will be very happy and very excited for a day or several days or a week. Then all of a sudden, someone sits down and so sad and moody and very disturbed, and you wonder what is happening. And it becomes a cycle of your life. And mentally, many times it starts to show up or prepare up around when somebody is about 17, 18, of course, depending on a number of other parameters. So somebody of that sort of very happy, very moody, and very hyperactive on a number of things. And then all of a sudden, it's very moody and having suicidal thoughts and himself and all that. And what happens is present himself with maybe episodes of very low, somebody will think depression and will be assessed depression, and only to realize, okay, this thing is just lasting for a week, not actually for 14 days as depression would be. And then bipolar, you realize that yes, this is bipolar. Of course, there are several tools for assessing bipolar. When you come to see me, I will assess that in case you are having this very high and then very low, or no, and then that's been a consistent behavior for the last 1 year.
Okay, good. Maybe I need to ask you this. There's some I don't know how to put it, but there is some maybe claims of homicide maybe in the country in the recent past. Even maybe this week there's some claims which is not I will not say it has not been authenticated. So of homicide cases. So how do people reach to that stage, and how could they have prevented that?
Well, those cases of homicide are cases that all started with a simple thing like stress and conflict in the family, and nothing was done at the right time. And this thing persisted and persisted and escalated to now more issues now affecting the reasoning capacity of this person. And this person is the best thing that I can do this time is to harm the other person. That's why we're calling them suicidal cases. And many times you will wonder, why did this person have to do this?
Yeah.
That person was doing that was not in his sober mind, was not in normal mind. Therefore, we say it's good to be able to detect any behavior that is not normal. It's also good to be able to manage stress when it's at levels that are manageable before it gets depression, suicidal, homicidal cases. And then talking about this, especially at this time of COVID-19, this challenge has not just and is not just causing physical or physiological pain and challenge. It has a serious impact on the brain of this. Number one, when you show symptoms, if I cough now, people will say, "Oh, kwani uko na corona?" So that on its own, it has a several meaning. So people being stigmatized and labeled and quarantined and isolated, that caused stress to these people because their normal lives have been disturbed. So COVID-19 has brought in a number of issues. So when people are disturbed psychologically, then chances are that at home, maybe even as we talk, I know there's somebody who will be looking at me for me because of something here. Later, it's already indicated that there's a lot of scandals and fights here and there because of the mother, the man, and the wife, the children are all there, and they are finding faults in each other, and therefore, slowly by slowly, their stress levels goes up, and without notice, because they are not well empowered in terms of conflict resolution and stress management, they end up messing themselves and take the wrong direction towards this challenge.
Good, good. So, like you're talking about in this time of COVID-19, our life has been disrupted. And there's so many situations. There's some people wanted to travel, they cannot travel. Others were maybe graduating this year, they cannot graduate. Others were pushing their businesses. Maybe others were planning great plans, maybe getting married. Even friends, maybe even my friend had to halt his wedding. Now, the question is, how do we actually mitigate that so that people don't get into deep depression going forward after this COVID?
I'll make it very simple.
Mhm.
Number one, adjust the new normal. Let's adjust to the new normal. No one anticipated, no one thought that things would be like this. No one expected that we'll get to this level. Because if the government knew, if someone knew, then he would have done the best. Because I have seen some tweets of French people castigating our political leaders because of one or two. But I tend to feel that it's all because of stress. They're also venting and they are allowed, but it's just the facts that no one would have really wished that we get to this level. Because economy has been challenged, our lives have been challenged, and we are stressed. So it's good to adjust. How do we adjust to this new normal? Number one is look at what do we need now? What are our priorities? And as at now, what do you need? Do I have food for today? Do I have some water? Do I have some to lay in my head? If we can meet the basic needs, it's good. If you wanted to travel, how important was it? Some of us love traveling. It's part of our friends and hobby. That's good. But as of now, you can hold on the traveling and travel every day. Maybe you wanted to go and celebrate the Easter holiday. And I've been locked here. I could not be able to go and celebrate the Easter holiday. What's important now? My health. So let me start here. Things like the wedding. Somebody was talking about wedding. You're going to wedding after this COVID-19 and you'll have good time with your wife and whatever. So as of now, you can postpone it. But if you still want to wed, then you can have the wedding, just the two of you and the presiding pastor and maybe a witness, 5 people, and you stream live like we are doing now.
Yeah.
And it's actually even cheaper. You'll have no cost in terms of reception and all these big cars and decorations and all that stuff. You have the cheapest weddings and you can still enjoy it. But of course, you have to quarantine yourself for 14 days to make sure that even the partner that you're married is not also having symptoms.
Okay.
Yeah.
All right. So, Isaac, not many people are even comfortable talking about maybe this topic. Many of the people maybe fear to be told about stress, anxiety, mental issues. They believe they cannot suffer from that. Yeah? And also, even there's some people even who go through a lot of issues, but they cannot even share online. So, how do you tell people who just hold their pain and they don't want to share with anyone?
Let me say, number one, that it is okay not to be okay. You can't live a perfect life all through. As long as you are in this world, you are either in a problem, having come from one, or just about to get one. That's a fact. So whatever that you're going through, it's always good to come out and say, I need help. That's a password. Being able to get to a professional is the best option. But before you get to a professional, talk to a friend, tell someone that you know what, something has happened. And in this life, shift happens, and F sometimes is silent because you can guess what that means.
Yeah.
Sometimes,
Okay.
sometimes things happen, and it's always good to be able to say, I need help. And if you feel like you don't want to go public, just think of some of us, like say, helping somebody who is far away from me, and just chatting and saying hi to keep in touch and to bring some sense to his brain.
Good, good. So I want to bring Alphonse to this conversation. Alphonse, how are you?
I'm fine, thank you.
Good to see you.
Thanks.
Yeah, so we are talking about surviving COVID-19 in terms of anxiety, stress in this situation. Maybe you can introduce yourself and then maybe we'll go to this conversation.
Yeah, my name is Alphonse Were, labor policy consultant in Nairobi. That's a big one. Surviving, particularly from a mental health perspective, and even just the anxiety issues, the social pressure it's bringing on board. But I think a quick one that I can talk about is everybody should be aware that there will be a moment when they will be low. There'll be a time of trouble, and there'll be a time of overjoy, not just normal joy. So both extreme joy and extreme stress or extreme stressful moments desire that we retain our normalcy in terms of calm. In this case, I think what I can just share with the public and those who are listening to us and viewing us now is this is a moment that's not permanent. However stressful it is, it will come, it will go. It might be the first one in our lifetime as a pandemic, but it's not the first pandemic.
Yeah.
Now, if in our lifetime we have never experienced or even had, most of us have never had a discussion about the previous pandemics, then it simply means that they usually come and go. Now, how we handle ourselves mentally and how we manage our stress levels and anxiety determines how we exit. Because some people will leave this dead, not because of the virus, but because of the anxiety and the stress. So it's on this background and backdrop that I think we should know that let's keep calm. Nothing, it will be stressful. It has destabilized us. It has moved us from our normal way of doing things, but it has not come to necessarily eliminate us from existence. So keep calm. However the stress is, keep calm and just live a day at a time. Don't live too many days in the future. Yes, if today you don't have enough food, remember you might be having food, but it's not enough. So work with what you have today. When tomorrow comes, somehow we'll see how to go and navigate around it. There have been lack of food where we have had situations in this society, in this world, when there was no food, worldwide, region-wide, countrywide, but still people exited that situation alive. Yeah, there are situations when people are very sick, they still left alive. Even deadly as Ebola, there are people who did not succumb, yet they were positive. So I think we just need to be a bit careful on how we extremely manage ourselves in terms of expectations in this situation.
All right. So, Alphonse, I need your perspective in terms of the increasing number of homicide cases in Kenya in both genders. It seems like in the recent past, we have been getting a lot of homicide cases. Even this week, maybe we are not sure, but there is some claims of that. What's your perspective in this, and why are we experiencing this?
One, we are a disintegrated society in the 21st century. What this means is that the family unit is no longer a unit. It's individuals assembled in one place, and what keeps most of the people together is the fact that we sleep together, but we rarely stay together.
Okay.
Now that the condition is insisting that we have no option but to stay together, Now, that is either reintroducing some stress that we are running away from, or bringing to us a reality that we were avoiding. So part of that is that we don't know how to handle ourselves, how to manage ourselves in terms of, if I can't do it, and the only route ahead was to escape, which was to be at work or behave as if I was away from the house. Now I can't go to that work, I can't go to the drinking spree, I can't go to church or any other worship place. I can't meet friends, I can't go and watch ball or whatever sport it is. Now, you see, whatever things you're using to escape have been closed. So the only place you have is the place you didn't want to be most of your time. And therefore you discover that now you have to face the reality of talking, and inferiority complex and lack of capacity usually makes people go violent most of the time. If you think that the only thing you want is either you can't answer, you can't discuss, you can't manage arguments on fact basis, so it's always a person, then most of the time it's caused by either inferiority complex, lack of content, actually just lack of capacity to handle the situation before you. So you have been using avoidance or escapism, which is no longer there because the place to go is not there. So then the only result remaining part is usually going physical.
Yeah.
And particularly for men, men go more physical and sexual to release the stresses and excesses they have when they have social disturbances. Women go more verbal. So more men at this point, majority of men are getting a lot of verbal attacks, and an increased number of ladies are also getting a number of physical attacks. But of course, both parties have their own lion's share. Also, we have men who are getting physical attacks and ladies who are getting verbal attacks.
Yeah, interesting. I remember, like you were saying, maybe men to relieve their pain and anxiety, they go that way. You are mentioning maybe sexual and also physical. I remember Bill Clinton mentioned this in his documentary, where he was saying that case with Monica only happened because he was trying to manage his anxiety and stress that comes with work. Do women really understand that stress that comes when being a man and handling some projects or even work?
Women understand, men understand, but we have some few differences, whether morphological, sociological. Kuna hii ingine mnaita nini? We call it the one caused by endocrine system. I think the hormones. So even we have the same hormones, but at different levels. As in, men have a specific hormone that is higher. Women have a specific hormone that is higher than men, and such things. So we have some key differences which affects our emotions. Now, I remember I had a session in 2015 with one of the institutions, and we were focusing mainly on men. And the topic was, do men really cry?
Yes.
Yes, and the answer is yes, they do cry, but their tears are not shed from the eyes. Because crying is an emotion when you have a pent up, when you have too much of negative emotional pent up, is you accumulate anger, you accumulate rage, then the next thing that is likely to come out is your tears or the cry. Now, for women, that will be more natural for the eyes to release the tears. For men, from a sociological perspective, how the society has wired the majority of us is that we should not actually shed tears. So what happens is that when we keep it within, naturally, automatically, then they must still get an exit. Now, this exit of the emotion, most of the time, comes through when men have a sexual activity, and it must be complete ejaculation. So if it doesn't even get there, then they will still have more and more anxiety building up, more and more pressure. So most men, they will run away and literally go and have it, either if not in the house, elsewhere. And the other one is where they go physical. They will literally hit things in the house. They will hit people. They will break things. You can see if the anxiety was very high, they're watching a match, expecting their team to win, and then their team is scored or loses, then the TV faces the rage. So that should be known. That is reality. It's factual perspective of science and sociology, and even psychology. Yeah, so it should be known. If we know that, then we are able to start managing several things, both by men and women.
Okay, good.
Yeah.
So maybe going forward, are we really, in terms of maybe education in our education system, are we incorporating the counseling and psychology strongly? Maybe when children grow up, they understand these differences and they understand to actually have some conflict resolution mechanism that is even better for society, where we don't end up to maybe cases of homicide and other suicidal cases.
I think we did this incorporation all through. What I've not seen is the what we are calling the new curriculum that I have not seen, but the previous curricula 844 included and the previous before 844. This is well inculcated. The problem has been the implementers. There are people who want to profiteer from the curriculum, so they want to ensure that some aspects of curriculum don't work well, so that they get it elsewhere as a private thing, or ideally, my view is that the curriculum considers this. We have psychology, we have, in fact, guiding and counseling is mandatory in all schools. The problem is that now when we make it's mandatory in syllabus and the curriculum, but in implementation, the teacher in charge has more responsibilities elsewhere. So we don't dedicate teachers for that specific role. We have a department with 2 or 3 teachers in charge, but then we don't give them capabilities to run that department as it should be. It's made like an AOB in the school system, and that is a problem of implementation, not curriculum itself.
Good. So maybe I want to bring Wakesa.
Hello.
Are you okay?
Yes, I'm hearing you.
You have echo.
Okay, let me redo it.
Okay, it's okay. So Alphonse, maybe
Yes.
in our society system, especially with all just our community, in our communities, do we have mechanisms on these psychological, maybe counseling ways? I understand churches do this, but maybe how about those people who don't go to church? Where are they expected actually to learn these things?
Again, is a problem of implementation. We have good regulations around these spaces, but you see, if you support people, they become independent. And in my observation, in many things, that independence is what the elites, both business elites and political elites, don't want. And so, since they are the ones with the capacity and be given the chance to do implementation, they rarely go that direction to implement such. But if the churches, it's just part of it. But you see, if the churches were to do this well, one of the things they need is to have specialists, not just member of church volunteering, but that a member who is supposed to do that job is supposed to be qualified. Now, counseling or psychosocial support, it's a specialization field. And for you to be qualified to be called a counselor, you need a minimum of a degree. That's the minimum qualification. Yet you have people who can do some help when they have a diploma or such, but the degree is where you start getting recognized. Yeah. So I think we don't even employ them in the first place. I don't remember the last time our government employed counseling services in our hospitals. We need them in all hospitals, for example. All of them, because, for example, if you want to, if you are a patient in this condition, you need somebody to take you through the support psychologically. So most of the psychological support currently in such a pandemic situation will come from people who are volunteering. Yeah. So I think our spending on human resource need to be a bit balanced, because there are key things we need to have which we don't have. We don't employ vet doctors, for example, yet such conditions are zoonotic. Now, if we have had a very good vet system, or veterinary system, which means we have employed vet doctors very well, we have empowered them, they are doing their researches, they're able to detect some of these things earlier, collaborate with their colleagues in the human medicine, and then we get things working and doing well.
Okay, good.
Yes.
So I understand maybe like you're mentioning, in Kenya, we have few psychiatrists, but we have so many psychologists, which are counseling psychologists. But of course, like, counseling psychologists are not in hospitals. Psychiatrists are there, and they are very few. Even when you try to look for them, it's very few to get. Yeah. Now the question is, why is this gap there? Like it should work holistically. And why was it designed to have such a huge gap? And what kind of policies? I understand right now maybe there is a committee to look into this, but what should the government implement?
I don't even think we need a committee. We just need to implement what we have. The issue is implementation. We just need hire them. Whether they are needed or not, that is clear. They are needed. It is in the policies that exist. Hire them. Now, hiring them is an action from the employer.
Yeah.
So if I say train them, they're already trained. So we have very many trained individuals in this space. Hire them. That's one. Why are we in this situation? Because if we hire them, then profit-making ventures in the same industry will go down, and we want to have privatization of everything we are doing. So that entrenches a lot of people becoming poor, remaining poor, so that we now trade in poverty as a business instead of helping people out of poverty to develop the country. Yeah, so it's a business model that makes a few people remain rich. They'll own big farms, they get tenders from corporations, and people can't get this for free. In fact, so I think to me, we just need to hire them. There's nothing we are having a committee for. We need to hire, just use the existing law, hire them. It's as simple as that.
Good. So maybe I want to come to corporates and maybe startups, what they are doing in this space. I understand Safaricom really does a lot in this space and for its employees. Yeah? But maybe looking at other maybe corporate companies in Nairobi and other places, what do you see them doing in this space in terms of their welfare of their employees and even clients?
I want to get you clear. When you say Safaricom does a lot, what are you referring to that they do?
Yeah, I'm referring to they have some welfare packages for their employees where they have maybe a psychologist or counseling psychologist who comes probably weekly basis to take care of their employees. In the headquarters, they have that kind of arrangement.
Now, I think if you had to compare Safaricom and Standard Chartered, for example, Standard Chartered has a more elaborate psychological support in comparison.
Yeah. Good.
However, bringing them at workplace is not a good idea. It will not work.
Okay.
Psychological issues are addressed outside the norm. So number one is people need to feel safe. So most people are stressed at workplace. So if you bring a psychologist at workplace, you increase the stress. People will not open up. Now, this is a process that requires people to open up. People won't just open up. So I don't think any institution bringing them, particularly if that is their model, regularly to bring them to serve people from the workplace, that is going to work. What's going to happen? People need to have a number they can contact anonymously, get assigned to somebody that they're comfortable with. Then that person works with them in the journey. The institution only bills. The institution only gets the bill, but that bill is mainly supposed to be based on the model that makes the psychological company run, not necessarily how many people they have served. So if we have a workforce of, let's say 1,000, we say 40% will come for the service this year. So then we get that billing earlier for 40. So if they go more than 40, fine. If they get less than 40, fine. But it's a service again that you cannot say 80% will come and get served. So that when they come at 40 is a very good projection. for both sides in terms of investment, and then that will guarantee more of the businesses not exposing who went there, because now you don't need to tell people the identities of the people who come for this service. It's usually one of the most confidential services required by people.
Okay, good. So I want to come to Wekesa. Wekesa, we are now about what corporates are doing in terms of the mental health status, that space for its clients as well as its employees. Now, maybe coming to you, what is your company doing in that space? First, you can introduce yourself and tell us in terms of yourself, what kind of things you are receiving. Number two, we can talk about, is it time for insurance companies to start considering counseling fee to be catered by insurance? Wakesa? Wakesa, can you hear me? Wakesa? Can you hear me? Wakesa? Can you hear me now?
Hello.
Hello, can you hear me? Me, I can hear you.
Okay.
Mm-hmm.
Hello.
Can you hear me, Wakesa?
Let me adjust my.
Mm-hmm. Can you hear me?
You're talking in echo.
Oh, you cannot hear me. Wakesa? All right. So there's a problem maybe with Wakesa's microphone. Wakesa, can you hear me now? Wakesa, can you hear me? All right. Yeah, so we have some network challenges. I think if I don't get Wakesa back in a minute, maybe I would like to just finish the discussion for today. So I want to say maybe everyone to keep safe, stay at home, maintain the measures that has been laid out by the MOH. Those who are on the front line, just keep up, and then we wish you all the best. And we'll see you next in the next session. Thank you and